Hello guys, this is Al, and today I wanted to talk about a nice scenario in radiation therapy, which is a scenario that the patient has implant and part of his body, for example, pelvis, like a femur implant, and this patient wanted to undergo the radiation treatment planning, and then with the research that they did it in 2002 2003, they understood that 1 to 4% of the patient uh, that actually come for the pelvis area treatment, they have the implant scenario. For in the past, that the treatment planning was not developed, and especially Monte Carlo algorithm, they had really difficulties for this kind of scenario, and basically based on this recommendation of the AAPM, or American Physicists in Medicine, American Association of Physicists in Medicine, they said that consider that part of the body that is high density as water, and then treat that patient 1 or 2 fraction. And basically what you do, you can, when you physicists talk to the physician or radiation oncologist, they can agree that even the same day, if they don't want it to radiate, they do a dry run for the patient and can do some dosimetry for the patient to understand the characteristics of the implant if it is not cleared from the patient or the patient record in the system. Therefore, at that moment, they can accordingly decide that if they do dosimetry, what is the beam attenuation would be through this material, because each material, if it has high density, like titanium, and we're using an implant, they have lots of beam attenuation into it. Therefore, they can treat the patient for 2-3 fraction in the case that has 30 fraction, like a water based. And then after that, they can adjust the monitor unit that's supposed to be patient get it during the treatment. Therefore, what is important is in the new era that we are living in 21st century, after 2009, that all of these fancy techniques, they came to the radiation therapy like VMAT. We basically can go very fast around the implant area, that basically the collimators, they can block the implant, and then when you go around that angle, the collimators, they go slower and deliver the gantry goes slower and deliver the dose. But it could be also a scenario that really the tumor is attached or near close by the implant, and this scenario definitely we need to define the high dense material in the Monte Carlo algorithm. That what we can do also in the CT scan, we can scan this material by the phantom, putting inside of the phantom, and define it for this new CT scan, which they are not all like before, that they had the 8-bit CT scan, and then bring this CT table to electron density and define it in our new CT scanner. And also the same when we bring it to the dosimetry in our treatment planning system, we can do that in the Monte Carlo, and then definitely adjust our treatment based of those modification, and then had a good plan for the patients. Therefore, definitely using the new technology help, but at the point that they were doing this kind of treatments, they were vague information. And if we have this information is from the beginning, we know what is the implant of the patient is, the material, definitely we can accordingly act and put everything during the CT simulation and also for Monte Carlo, and then adjust the patient treatment planning. And another thing is basically when deliver the dose to the implant is very dense material with a high Z or atomic number. Therefore, it attenuates a lot of the beam. However, the problem is emerge when this implant is attached to the bone, because it's part of the bone. Then the bone gets lots of doses, because nothing is going to happen to the implants, because it's very could be very radiation resistant. But what happens is going to make a crack in the bone of the patients. Therefore, this is really critical. And then also the research showed that if we send the beam through this part of the intense thickness of the implant, they were thinking that very nicely it just attenuate. But it understood that this when the beam hit the implant, there are lots of electron density. A secondary electron is produced, which actually contribute to the dose of the patient. And also during the passing the beam from distance material, there are lots of pair production happens, that basically we don't get a very homogeneous or very linear attenuation. And this is really contributing the more dose to the patient. Therefore, we have two peaks, one from the secondary electron that we get from the Comptons, and then also pair productions that we get in the second edge when it comes out of the dense material of the implants, that is really not good for the patients. Therefore, this kind of interesting scenario is really good when we wanted to care about the patient, because the important things in radiation oncology or physicist is making a very safe delivery care for the patient. And then each of these steps, from the CT simulation, from the treatment planning and dosimetry that we do for the patient, that was verified by the physicist and the radiation oncologist, is super important and critical in the care of the patient. And I'm happy to share all of this information for you and with you. And then have a wonderful day, and gives us thumbs up, subscribe for channel, communicate with me through the comments, and have a wonderful day, and bye till next video.